made in addressing stigma and discrimination and providing treatment to people living with HIV on World AIDS Day. Joining us to talk more about this is Executive Director for the Jamaican Network of Seropositives. Always a pleasure to have him here, Mr. Jamuki Patrick. Hey, Jamuki, morning. Welcome to Smile Jamaica. I'm smiling. Well, first of all, tell us about JN Plus and the work that you do.
Started in 1996. Started by Ainsley, the first Jamaican to publicly say that he's HIV positive.
Yes.
We have transitioned into an NGO providing care and support services for people living with HIV since then. Working in Jamaica in all the health regions, have 55 staff committed to care and support services, support group, capacity building, just providing the necessary resources and opportunity for people living with HIV to be dignified and to feel empowered as Jamaicans.
One of the things that touches my heart about JN Plus is what you just said, and that's support. Because sometimes a lot of persons, when diagnosed with HIV, they feel like, I'm alone, I don't have anyone around me, I'm afraid to tell family, I'm afraid to tell friends. What do I do? And JN Plus provides that safe space for them to come in and get counseling and support.
Definitely. I think a lot of Jamaicans believe that people living with HIV should look a particular way, should be sick, should be dead, should have whatever over their bodies. And the science of HIV has changed significantly since we know of HIV.
I want to talk about that.
And so we are here to support people. Seeing somebody else who is HIV positive is important for those persons who have low self-esteem. We did a stigma index survey which says over 53% of people living with HIV feel dirty, ashamed, or worthless because of their HIV status. And if we have people living with HIV feeling that way, we need to do more in terms of support, psychosocial support, building their capacity, helping them to understand that it's okay to be HIV positive. You'll survive.
Yeah, because as you said, the science, oh my gosh, it's come such a far way. And we're now at undetectable.
Equal, untransmittable.
Untransmittable. How has that impacted the HIV community?
I mean, it's still a process happening now across the world, and Jamaica is a part of it, to know that you can be living with the virus and it's undetectable, meaning a regular HIV test will not pick up the virus unless you do a blood test, and that you can have unprotected sex as somebody living with HIV and not pass on the virus, should your viral load be low at a certain level. It's a revelation. It's really an aha moment, and so you recognize people living with HIV and see that, well, there's no need to stigmatize and discriminate. There's no need to say that people living with HIV are going to die because of the new science, because of medication, how medication has advanced since many years ago.
Yeah, it's a virus. It's a virus. And we've seen many viruses over the past couple of years, you know, and I hope that one day that people will begin to see it as such. And then the same ways we approach other viruses, we do that as well. But my concern, and my concern, Jamuki, is what you've been saying. The stigma and discrimination is still not allowing people to come forward and say, I'm HIV positive, but I need treatment. Because HIV, if you are on treatment, you long fulfilled lives.
Long fulfilled life. In Jamaica, we have over 30,000 people living with HIV. Of that 30,000, only 47% are retaining care on medication. So that's a big problem. That means that over 50% of people living with HIV are not in care.
I've decided that they prefer to try them long.
And we have been trying to figure out, why are we having this as a country?
Stigma.
There you go, discrimination. And even if it's not in the healthcare, it's in the communities, it's in the workplace, it's in families, and it's in churches. And we're seeing that a lot, especially at JN Plus, where we get these cases and reports from people living with HIV about them being discriminated. And so it requires a stronger partnership. Hence, the World AIDS Day team Equalize, doing more in terms of accessibility, sustainability, and the quality of service that we provide for people living with HIV in Jamaica.
Yeah, it is unfortunate, and I think in 2022, but we need to do better. So what's the significance of World AIDS Day this year? I know the significance every year, but this year, I see the theme is Equalize.
Equalize. Wow, we have been doing this every year, and this year, the global community decided Equalize should be that theme. And it's really centered around, like I said earlier, bringing awareness to the injustices, the inequalities, the issues affecting people living with HIV that are preventing them from accessing treatment and care, and also for those impacted, the prevention services. What are the laws, what are the policies, what are the protocols, what are the community issues that are affecting the people living with HIV for them not accessing care, and how do we converse as stakeholders, whether government, civil society, private sector, international development partner, and as well the communities impacted by HIV to know what else to do, what more to do to better the system, to better the healthcare system. Remember, HIV has moved away from a public health issue to a development issue.
Correct.
So COVID has affected HIV in so many ways. Monkeypox has affected HIV.
Correct.
And people living with HIV have other comorbidities that are affecting their lives. And so we're trying to look at a more integrated approach as to how we can treat people living with HIV, not to sectionalize when they come to health facility and stuff like that. So it's very important on World AIDS Day, December 1, which is not today, tomorrow. We talk more about what we are doing as a country in terms of things that we need to do better at for people living with HIV.
Absolutely. Confidentiality, privacy.
There you go.
Those are some of the issues that have to be addressed. So what are some of the things that you're going to be doing? I know you've been doing a series of things leading up to tomorrow.
Right.
But for this World AIDS Day, what are you doing especially for that day?
So, well, we're having a breakfast forum today starting at 7:30 at the AC Marriott Hotel, where we're bringing all the stakeholders together, including the community of people living with HIV,
nice,
to talk about what I just said to you.
Yes.
It is important for us at Jane Plus as an NGO, but more so as a community-led organization with people living with HIV, to initiate and to lead the conversation. We need to see more people living with HIV leading the conversation and not be called to the table just because, but leading the conversation and talking about the various issues. So we're doing that today at the Marriott Hotel. We'll be going to the Jamaica AIDS Support Candlelight Vigil. We have been doing school tours, so we have a couple more coming up. We did Marcus Garvey Technical and we did Ocho Rios High School, I think on Monday or Tuesday, and we have some more school to go. And on Saturday, we'll be having a health and wellness fair at Excelsior High School. That is what we are doing at Jane, but I know the various partners are doing their thing.
Everybody's doing something, and I love it. That how active we are on World AIDS Day, all the civil society groups, NGOs. Jamaica needs to be the Caribbean country. We're leading a lot of things, and this is one thing I'm depending on Jamaica to lead on, just sensible thinking and get it done. Thank you, Jamaica.
Thank you for
all the work you do. Executive Director for the Jamaican Network of Seropositives, Mr. Jamaica Patrick. Stay tuned.